Cardiac arrhythmia, as the term connotes, is arrhythmia, which is absence of rhythm or altered rhythm. Well, by rhythm of the heart, you fundamentally mean that there is a cadence with which the heart contracts, and that's fundamentally because of a beautifully built-in electrical mechanism in the heart. Whenever there is a disturbance in this electrical mechanism, so the heart rate can vary from very low to very fast or very irregular. So this is basically the arrhythmia. And the patient can feel this arrhythmia in various forms. And when we do some testing, then we diagnose the cardiac arrhythmia. Yes, the arrhythmia can be either a fast heart rate or a slow heart rate. The fast heart rate is otherwise called as tachycardias, and the patient presents with palpitations. The slow heart rate is called bradycardia, and that the patient usually presents with dizziness, loss of consciousness, weakness, and fatigue, etc. The symptoms of arrhythmia, if you look at tachycardias where the patient has very rapid heartbeat, just to introduce what's a rapid heartbeat, upper limit of the normal heartbeat is about 100 to 110. So anything more than that which is not related to exertion is pathological, and it can be called as a pathological tachycardia. Otherwise, on exertion, physiologically your heart rate goes up to a normal heart rate. So when there is a tachycardia, the patient feels an abnormal heartbeat pounding in his chest. So he can come and say that he gets pounding in the chest, or he gets a rapid pulse, he can feel a rapid pulse, or he can feel a rapid fluttering in the neck, or he can even have dizziness. And if the heart rate is extremely fast, they can even lose consciousness and have a blackout. If it's a slow heart rate, bradycardia, they can have dizziness, they can have very bad fatigues, and again blackouts. If the heart rate is abnormally slow, they can have a blackout. Well, fundamentally, let's look at how are they diagnosed first. So when you suspect a person to have a cardiac arrhythmia, it's very vitally important to record an EKG or examine the patient while he has the arrhythmia. So the most fundamental tool is to record an EKG when the symptoms are present. So that will confirm the fact whether the heart rate is slow or fast, and is it pathological. So once we establish the diagnosis using either ECG or a Holter monitor or an event recorder, all forms of recording EKG, then we can plan the treatment. And the treatment can be either reassurance if the doctor feels it is a simple problem, or we can give him medications to suppress the arrhythmia. The medications which can be very simple or can be very complex medications. Or finally, we can try to cure it permanently by locating that abnormal electrical focus which is responsible for the arrhythmia. In one of the arrhythmias called as atrial fibrillation or atrial tachycardia, supposing the person has sudden onset of such a rhythm problem, the heart is very fast, and his blood pressures are affected, his symptoms are affected, he's feeling dizzy, then we can give an external controlled electrical shock and revert this arrhythmia. This is called cardioversion. So it's usually done under anesthesia. It's an emergency procedure most of the time, or it can be an elective planned procedure where we anesthetize the patient and under full sedation, we give a controlled shock. Like I mentioned, arrhythmia can be a slow heart rate or a fast heart rate. So when the heart rate is pathologically slow, it's not enough to sustain the patient's day-to-day living or day-to-day quality of life. So we need to increase it externally, and that's the function of a pacemaker. So a pacemaker is usually a small device like this. It used to be very big, and now it's come to this size. This is implanted in the subcutaneous tissue in the chest of a patient, and this is connected by a lead which is fixed to the pacemaker, and it goes into the heart. And through this, an electrical impulses are delivered to keep the heart rate at a sustainable level. Implantable Cardioverter-defibrillator is We discussed about defibrillation, we discussed about automatic external defibrillators. Now, it's not always that the patient is fortunate to be in a place where there is an access to a defibrillator. He may be on a train, or he may be traveling in a remote holiday destination. So you may not always have an access to such a device. So these defibrillators are inbuilt pacemaker-like devices which have an ability to sense a very, very fast heart rate which is life-threatening and give a shock automatically. So these are larger than a pacemaker. Yeah, there's a slightly larger than a pacemaker, and they are attached to the heart in a similar manner like a pacemaker, but they have the ability not only to drive the heart rate up, but also when the heart rate is very fast, to detect it and counteract it, shock it and terminate it. These are life-saving devices, and they're implanted in patients who are at risk of so-called sudden cardiac death. So this is useful in situations where the patient is at risk of sudden cardiac death. And this can happen in some situations where after a heart attack the heart function is very low. They're prone to sudden cardiac death, and usually we implant these devices prophylactically in such patients. There are certain patients with hereditary disorders of the heart called hypertrophic cardiomyopathy, long QT syndrome, where they're again at risk of a sudden cardiac death, and they're very much helped by this device. This has been one of the greatest innovations in cardiology. This is implanted in the subcutaneous tissue and connected to the heart just like a pacemaker. The battery life varies from 5 to 7 years, depending on the usage. Usually it has to be changed once in 7 years or 8 years. We move on to the situations where the heart rate is rapid. There are certain conditions called supraventricular tachycardias, atrial fibrillation, where in spite of medications, the person continues to get palpitations which are disabling his quality of life. These are not really life-threatening, but they're a big nuisance. You have to make frequent visits to the hospital or take certain very complex drugs which can produce side effects. So in such patients, we resort to what's called as an electrophysiological study followed by radiofrequency ablation. During the electrophysiological study, we place special catheters into the heart, locate the focus which is producing these abnormal heart rhythms, and by recording an ECG from within the heart. That's what electrophysiological study does. And once we do that, we use a special catheter which has an ability to deliver radiofrequency energy at the precise location where the electrical focus is being generated. And that can permanently cure, and the patient can be free from the problem for the rest of his life, and no need to take any medications. Catheter ablation is one of the methods of catheter ablation is RF delivery, the radio frequency. You have other energy sources, cryo and laser, but for the commonest one that is used is the radio frequency energy, radio frequency ablation. We do all the procedures: pacemaker implantation, defibrillator implantation, radio frequency ablation, and we also do radio frequency ablation using 3D mapping, which is a sophisticated mapping system which allows us to more precisely localize the problems. Yes, these are all scheduled procedures. They can travel on for this, we can discuss. And the advantage of Health City Cayman Islands is very cost effective for this procedure.